welcome. Today we're going to be talking about online medical advice. Online medical advice. Websites are an effective way of distributing healthcare messages and promoting awareness of issues. Diagnosis sites, operated either by governments or individual clinics, range from simple pages with information about common illnesses to interactive sites which allow for users to input multiple symptoms and their severity, similar in some ways to a medical expert site. A Contact Us site. These sites allow you to send questions via email or even live chat with a medical professional. AskTheDoctor.com is a completely free service where you can ask our network of physicians and healthcare related questions. Sign up for the website to get personal questions answered by doctors, daily health challenges to improve your well-being, and connect with other users suffering from similar conditions. Also, there's another website called Just the Experts, which will be referenced in the bibliography later and shown here on the screen. And this is a provider of an advanced interactive website that allows healthcare professionals to provide services to patients through a live interaction or through email. The site also allows users to generate and access health information. The content on justhealthexperts.com is for educational purposes only and is not intended to replace the advice of a healthcare professional. Social media websites. The New York City Department of Health and Mental Hygiene has even used Facebook pages and applications to promote condom use and battle HIV among its population, while in Barcelona, doctors have used Second Life to provide anonymous information on sexual health and drug abuse to teenagers. In Europe, the president of the European Men's Health Forum suggested that Facebook and mobile phones should be used to provide health advice to men, who often neglect to visit doctors and ignore signs of potentially life-threatening cancer. Medical advice sites. Medical advice sites extend patient care beyond diagnosis and treatment by providing assistance and preventative advice to patients and their careers. Such sites exist for many topics, including heart disease, contraception, self-examination for cancer, dental care, and pregnancy advice. These sites are also useful forums for publishing information about public health scares, such as bird flu and swine flu outbreaks of late 2000s, along with health news updates and answers to frequently asked questions. These techniques help reduce the amount of time doctors and telephone helplines spend dealing with the common questions and minor problems. Support group sites. Support group sites are another form of online health advice. They are particularly useful when doctors, hospitals, or clinics do not offer their own support groups, or when even locally based groups are inaccessible because patients or carriers are housebound. Forums and chat rooms, both of which can be relatively anonymous, help put patients and their carriers in touch with others living in the same condition. Groups exist for many conditions including cancer, Alzheimer's disease, drug and alcohol addiction, spousal abuse, and eating disorders. And here you can see a website with a list of many different help groups which people can join. Risks. The key risk associated with online medical advice sites is the authenticity of the authors. It is difficult or impossible to know if they are medically trained, which leads to the reliability and integrity of the information being called into question. This is a particularly significant issue because many people, especially the young, rely on internet for health advice. A UK government survey found 80% of teenagers have sought information in this way. One study for the medical journal Archives of Disease in Childhood found only 39% of 500 health sites tested offered correct advice, with much of the information available being confusing, contradictory, or out of date, or just plain wrong. The study also found that sponsored links push to the top of results through payments to search engines never contained the correct information. A separate study found that advice regarding children's health was particularly misleading. Health sites operated by governments and health services were found to be error-free. Reliability. Impacts of incorrect health advice could be severe, with patients either delaying or avoiding treatment based on belief that they are not ill. Suffering and worrying excessively based on incorrect diagnosis found online, or even self-medicating based on incorrect information. Online study suggested that even correct online health advice could cause health problems, as patients tend to focus on the advice they want to hear, rather than what's actually happening to them, typically reassuring them rather than the advice which suggests there is a problem. Recommendation. The recommendation for those seeking online health advice is to use only government-operated sites. For example, the NHS Direct run by the UK's National Health Service. Most sites also recommend that for suspected serious conditions, a doctor is still consulted immediately. Privacy. Privacy concerns are also significant for those seeking online health advice. Although the internet appears anonymous, it is clearly not the same. Search results can be used to track down individuals. IP addresses can identify a user, and internet data packets travel through multiple machines en route to their destination. Wireless connections also need to be configured for security. Users also need to be sure that the site they use will keep their details secure against unauthorized access, and that they have a privacy policy that confirms personal details will not be passed on to third parties for advertising or other purposes. And here's a bibliography of some useful sources in creating this PowerPoint. And here at ITGS Guru, we close with, stay nerdy, my friends.